No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center. Hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter total.
So to begin with, as I told you, I am basically an allopathic practitioner, but over about 30 years of experience. But uh, though I'm a surgeon by heart, I found dermatology and other parts. There were certain things in allopathy which were not giving permanent cures, and I thought we were only suppressing things rather than expressing them and getting a complete cure. It was in this endeavor that I just about in COVID, I took up a course in veterinary homeopathy from Kerala Veterinary and Animal Sciences University. And for everybody's knowledge, three universities in Delhi in India are giving a degree. One Kerala, the second is Ludhiana, and most recently Bihar. So, what exactly is homeopathy? Homeopathy was a medical discipline which was started by Samuel Hahnemann, himself a practicing medical graduate in the early 1800s, at a time when there were ridiculous kinds of therapies, including bloodletting to get a patient all right. And he found that these were not curing, but they were actually causing more harm than cure. And he advocated for a gentler, more holistic approach with three basic principles. There are seven principles, but I'll just talk briefly on three. The theory of similia, which is like cures like. The theory of simplex, where only one remedy at a time should be used to cure a patient. And the third is the theory of minimum dosage, which basically means that the lesser the medication there is, the better the cure will be. This is something we allopaths would never agree on, because for us, if the dose is 5 to 20 mg, or let's take cytopoint, if it's 1 to 3 mg per kg, we all know sometimes we require 3 milligrams per kg of cytopoint to bring about a cure. But for the homeopath, the best medicine would be one which is in the ratio of 1 is to 50,000 in dilution. So one medicine which is 1 is to 50,000 in dilution would be much more effective than a medicine which is in grams or milligrams. There are three principles in homeopathy. One is the totality of medicine, which I was using till early 2024, which it did, where one does not believe in only curing one particular part of the body. Every body has a vital force, which we can call in homeopathy, but in allopathy, we call it our soul or our own innate immunity. And this is what controls the body. To revive the vital force, just one organ system remedy is not enough. Instead, if you are treating the skin, a homeopath would not only treat the skin, he would also treat the mental symptoms, the physical symptoms, the skin. If the patient has some kind of arthritic problem, that too would be taken into consideration. Whereas, as an allopath, when I was treating skin, I was only treating the skin, and any other secondary problem, whether it was a cough or an arthritic problem, were ignored by me totally. After matching all these symptoms, a homeopathic remedy was selected. Before I go on, I would like to tell everybody that one thing which I have seen, that often many of the problems which we see happen just after vaccination. And in fact, this is seen internationally. After vaccination, sometimes a minor dermatitis or a loose motion or a respiratory cough comes up. And in case this happens, I would suggest you to give just one dose of Tuja 200, and this brings the vital force back into order. Instead, even in my clinic, what I used to do, if there was a kind of allergy or a dermatitis which had come up post vaccination, I would be giving some anti allergics or probably even antibiotics, depending on the case. And antibiotics, and then I would see that a secondary problem would develop, probably a cough or a cold or something else. Totality of symptom, according to Hahnemann, was the total part of the symptom which the physician had to take by a means of his art and science, and it was the outward expression of an inner disease. So if you look at this picture, it is not only the red parts or dermatitis which a homeopathic or homeopath is interested, but he wants to put the entire puzzle into one piece. He takes the black parts, maybe arthritis, green parts, maybe loss of appetite, the blue parts, the mental symptoms, and only then does he proceed. And this is what we have started doing in our clinic, not only for dermatology, but for any other problem. Now, if we take this patient who had an eczema, here we have to take his anxiety, his irritability, his company which he preferred. Maybe the dog does not want company, he wants to be alone. His fear, whether he was restless or he was restful, whether he's a timid patient or an aggressive patient. And then lowest on the list were the eruptions and all the other kind of skin symptoms which he had. So it was not only the skin, but the totality of the patient which was taken and which is still taken to cure any case, whether of dermatitis, gynecology, or cardiology. I would like to begin by telling you that the second part, apart from totality of medicine, is the constitution of a patient. In 2024, after having failed multiple times using totality of medicine, I had joined the International Association of Veterinary Homeopaths, and I was introduced to this beautiful concept where they took an individual as a whole, and it took the physical, emotional, mental, and even hereditary tendencies into consideration. Now, if we look at certain remedies, for example, a very common medicine which is used is called pulsatilla. The pulsatilla patient is what you would see in a very timid toy pom. He would be emotional. He would have a very gentle nation. He would be shivering. You can see them very clearly. You know they are pulsatilla patients. Whereas a German Shepherd who comes, who looks dirty, who has a terrible smell, who doesn't like to stand, who looks lazy, and who looks very dirty, would probably, and is aggressive, is probably what we call a sulfur constitution. A Calcarea carbonica constitution is very clear. Those are the fat labs, the very obese labs, and they catch all sorts of skin infections almost immediately. So what? And there are 26 constitutions, out of which about 9 or 10 I have been able to identify in dogs. And based on the constitution, when I started giving constitutional remedies, I have been able to bring about a certain amount of control, even in atopy, which used to bug me no end because all the remedies used to fail after a certain time. So constitutional remedies are basically deep acting based on a person's constitution and include the physical makeup. Like I told you, a Labrador who is extremely fat and obese is Calcarea carbonica, whereas a very tall and active yet friendly dog could be called a phosphorus constitution. The mental and emotional traits. What are the fears the patient has? There are all homeopathic medicines have mental symptoms, and based on the mental symptoms, we are able to choose a certain remedy. Modalities, what worsens or what improves. A very beautiful example of this is a medicine commonly used by people in Delhi because we had a lot of rains this year. and that is rustox. The rustox patient is absolutely restless. He does not like to sit at one place. He keeps moving around from one place to another, and all his symptoms get worse in either change of season, change of temperature, and mostly in the rainy season. I've had a lot of cases who improved this year after I learned about this remedy after using rustox. Similarly, modalities would be there are certain medicines like mesarium, which work better in winter, natrum sulfuricum, which works better in summer, and sorinum, a drug which actually we don't call them drug, we call them remedies. And the sorinum remedy is given whenever the symptoms appear periodically. And then we have what we know as a miasmatic background, and I'll just tell you about this in the next couple of slides. General tendencies like cravings, aversion, sleep patterns, and thermals. Thermals are very important and are very easy to recognize in dogs. Does the dog like to sleep in an air conditioned room? Does he run out of the air conditioned room? Each has its own set of remedies. Cravings, on the other hand, are very difficult because we don't know whether our patient wants to eat a sour apple, do we? We don't know. We don't know whether he has a craving for bread. That also we don't know. But we can know about aversions. Aversions are simple. We give him something and he just totally ignores it. That is an aversion. Atopy, which I told you, which I was having a lot of trouble for many number of years, I have started having about 30 to 35, 40% cure or control without our allopathic drugs since I started using constitutional medicine and the next set of medicine which I will be referring to, which is known as miasmatic references. I am compiling data on this, and maybe by next year this time, I can give you a whole set of patients. Now, this beagle was treated constitutionally for atopy, and these photographs, which you can see, are about a month apart. Now, in this particular case, this dog had very severe atopy and had been on Cytopoint for a very, very long time. And in fact, before Cytopoint had been introduced in India. And in the first few injections of Cytopoint, he had been showing tremendous improvement, a lot of improvement. And he was getting it initially at 2 mg per kg. But even after 3 mg per kg, after a certain time, he did not respond and the condition began to grow very bad. So this patient is now without Cytopoint for the last 4 months?
Yes.
And before this, sir, his face was completely black and disfigured.
I sent you the photograph also.
Yeah. So now currently
with homeopathic treatment.
homeopathic. Okay, another case which we had a large amount of success with constitutional remedy is either we can call it post-clipping alopecia, or in certain cases in POMS, we had alopecia X, where we lost a large amount of hair. And you can see this particular husky who did not have hair for close to 2.5 years. But now, after constitutional remedies, you can see him on the right, and he has shown a tremendous improvement. And I have about 6 cases of alopecia X in POMS who have totally responded to homeopathy after about 2 months of treatment. The next part is what we call miasms. Now, miasms in homeopathy is the most deeply seated disease which has a genetic predisposition. My most obvious example would be the beagle, a bugbear for any dermatologist. Psora, psychosis, syphilis, tubercular, and cancer. These are the different kinds of tubercular miasms which we see. Psora, the oldest and most common miasm, about 80%, has severe itching, skin eruptions, allergies. It has a hypersensitivity, but a hypoimmunity. That's the difference. Hypersensitive patient with hypoimmune system. Psychosis. It is characterized by overgrowth, excess tissues, warts, and drapesis, and excess state. Please see the difference. This is an excess state. Syphilis, on the other hand, is a destructive miasm and leads to ulcerations, decay, tissue destruction, and has a breakdown of tissues. Two other miasms were added later by homeopaths. One is tubercular, and of course, we all know cancer, which is a combination of all three. I, as a dermatologist, use a lot of psora, psychosis, and syphilitic remedies to cure my patients. But when I come to other conditions like tumors, we also had tubercular and cancer miasms. Now, this, as you can see, is classically a psora miasm, redness, heat, severe itching. So, one of the remedies which cures a psora, either graphitis, sulfur, or sorinum would come here. And there is a differentiation which I'll come to in the next slide, in a few slides. Yeah, it's here. So these are the three anti-psora medications which I think everybody uses, and everybody, including me, makes horrible mistakes in this, because these are certain medicines which should be used very, very carefully, because it can cause an exaggeration of symptoms if used in a wrong dose. Sulfur, sorinum, and graphitis. The difference is sulfur is a very hot patient. He needs an air-conditioned room throughout. He is dirty looking, etc. Sorinum, on the other hand, is a chilly patient. And the sulfur patient, incidentally, will always be very thin and cachectic. And a sorinum patient, on the other hand, will need a chilly room. I mean, he's a chilly patient. He will need a very hot environment. He leave the AC room and go out. And sorinum is made, incidentally, from the scabies mite. And graphitis is a medicine wherever there is excessive oozing and stickiness. That is where we use graphitis, and he too would be a chilly patient. The biggest mistake we make is using it in high potencies, and I would not like any veterinarian to use it above the 30 or maximum 200 potency. Do not use it in a 1 m potency, which is a high potency. Second, all these anti-psora medicines, just a single dose lasts for as long as 3 weeks. So do not make the mistake of repeating anti-psora medications too often, because you will cause a severe exaggerations of signs, which may then be difficult to control. Now, here we have what we call a psychotic miasm. A psychotic, as I told you, is an overgrowth. Please look on the right-hand side and look at the date on the particular slide. This is a patient from Bangalore, my lawyer's sister, and on the 11th of June 2025, she sent me this picture out of desperation that the surgeon had said it had to be operated, and we can see 2-3 overgrowths on the right eye. And I gave her a remedy which I searched for. It was called Upastute, and you can see the next picture on the right. On 19th of July, all of them had disappeared. And these kind of cures, in the last 1 year, we must have cured at least 25 to 30 cases of warts and growths around the eyes. Now, when we come to warts, please understand that warts, it is just not that there is one medication for every wart. Warts differ on the size, on the kind of bleeding, on the kind of pedunculation they have, and where they are situated. So for warts, if they are on the teeth and genitals, we use Sabina 200. If they are the face and hands, I use Dulcamara 200. If I see warts which are cauliflower and pedunculated, only then do I use Thuja. Whereas for round, smooth warts, I prefer Ruta. Any wart on the mucocutaneous junction, I go for Argentinum nitricum. And believe me, at least 30 to 40 cases we have cured just this year, because they had all been referred for surgery. And with this medicine, Argentinum nitricum, we are able to cure warts on within their mouth. Also, Argentinum nitricum as a remedy acts not only on the mouth, but it also acts on the rectum. So if you have any warts or growths on the rectum, Argentinum nitricum is going to help you. Very important. Warts is not Thuja, at least not always. Please remember this, because I know till I studied homeopathy, for me also every wart meant Thuja, and every stone meant Berberis vulgaris, and every skin disease was sulfur. but that's not the case. Now we come to syphilitic miasms. What was syphilitic miasm? Where there is ulceration, destruction, etc. Now, here we can see this was a case I think I had discussed on the group also, IAVD group, long ago, and there will be a lot of oozing and ulceration. This particular case was of a hepatocutaneous syndrome case, which Nagarajan sir had requested me and asked me to present in Pune, I think this year or last year. And of course, we gave him, or this case, we gave all the treatment which Nagarajan sir had told me, including the amino acids, etc. And we found that while on treatment, he was tending to improve. But the moment I stopped the treatment, he showed a recurrence. And that is where I started Hepar sulfaris 200, which is a drug which is used for miasmatic syphilitic diseases. And I was able to get a permanent cure from, I think, April 2025. This patient has been normal. They're almost, there's a list of medications which are basically called Sarcodes and nosodes. So Sarcodes are those medicines which are got from the healthy tissue of, and Sarcodes are got from a healthy tissue of animal. And we can think of medicines like thyroidinium, insulinum, testis erecta, laccaninum, lacphalinum, etc. Whereas nosodes have been got from diseased organisms and include distempericum, sorinum, renal calc, tuberculinum, diphtherinum, etc. Now, if I get a case of thyroid where the FT4 is low and the cholesterol is high, and I can see he's obese, he's heat-seeking, he's got a mild bradycardia, etc., I do not immediately start a thyroid preparation. Instead, I put him on thyroidinum 3x or 6x initially in the clinic and see if he responds to this homeopathic preparation for the next 2 months. If I'm able to get good results, I continue with this. Otherwise, I obviously shift to an artificial thyroid preparation at 22 micrograms per kg body. Similarly, in those cases where I see that there is a dermatitis post either spaying or castration, I go for this preparation called testis. There's another preparation called euphorium, and I see that there is a lot of difference in many of the cases. Lac caninum and lac vaccinum, these are other products which we use. Lac caninum is a medicine which we use a lot in our clinic for pseudo pregnancy. Sorinum, as we all know, is made from the scabies mite, and I've already told you it's one of the SORA medications, and the patient will be extremely chilly and there'll be a lot of pruritus. Lycinium or a hydrophobium is a preparation made from the saliva of a rabid dog. And in our clinic, the moment any of us are getting bitten, which we get bitten very often, then what we do is we take a few drops of hydrophobium and then we also put it on our fingers. That does not mean even for a moment that you don't take your post-bite rabies vaccination. This is just a layer of protection over that. Thyroidinium, I told you, testis cicata and euphorium. These are the three medicines which are very, very common preparations which we are using among the Sarcodes. And I told you about testis cicata, wherever there's a dermatitis, which is there post your castration, I have tended to use this. And here we have to understand, we have to figure out that there might be a certain number of dermatitis cases which might come up post-castration or post-spaying. And if we're able to correlate the two and then use these preparations, we will get much better results. Now, what are Tautodes? This is something which I have started using very recently, maybe about July and early August. Tautodes is a method of using potentized versions of the same substance that may cause harm to help or detox the natural effects. It's not on a homeopathic preparation or like cures like, but same cures same. So if you have had very bad experience with corticosteroids, and I've started using cortisonum 200 in cases where a lot of our skin ointments like Spectrazole or Kiskin has led to our Cushing syndrome, there I have seen that cortisonum 200 has helped a lot. Similarly, there is a preparation called ACTH, in homeopathy. That also helps a lot in Cushing syndromes. I have not put it down on this slide, but that is also a preparation which can be used. So Tautodes can be made from any medicine from which we feel could have had certain effects on the patient. And that is when I thought that I should do something a little more, a little out of the box, which is not there in our homeopathy textbooks. And I made a tautode for cytopoint. So wherever the patients who I gave cytopoint, after that, I got a cytopoint tautode made by one of my homeopathic pharmacy representatives, and I have been using it from end July, early August 2025. I don't know how much the results I can talk about right now, but maybe in about 6 months, I'll be able to tell you more. And my rep is now making a tautode for oclacitinib. And all those patients, obviously, it's not that I'm only using homeopathy. I am using oclacitinib, I am using cytopoint, I am using cyclosporin. I occasionally have to give steroids, etc. Everything we do, we all give all our normal omegas and niacinamide. We do everything. So I only feel that as a homeopath, if I am giving oclacitinib, I would also like to give a tautode for it and see if I can reduce the effects, if any, of oclacitinib on my patient. Apart from this, there are certain medicines you can give to any patient who has a skin disease. Out of this, the three most common are Skookum Chuck, Echinacea, and Berberis aquifolium. Now, the list is here. As you can see, for Skookum Chuck, it's there for eczema, psoriasis, urticaria, dermatitis, rashes, fungus, warts, etc. And Skookum Chuck is available as small little pill tablets at either 3x or 6x potency. And I give it wherever I feel that I just want to increase the innate immunity of the animal. The same is the case of Echinacea and Berberis aquifolium. And here, as you can see, in Echinacea and Berberis aquifolium, the different conditions where we can use these particular drugs have been mentioned. Both Berberis aquifolium and Echinacea are used as mother tinctures. Please remember, there is a difference between mother tinctures and dilutions. Dilutions are those which come in 30, 200, 1 million, etc. Whereas mother tinctures are the crudest form of the drug, the one closest to the existing plant or product. So Echinacea and Berberis aquifolium is basically going to be Echinacea and Berberis aquifolium are going to be to increase your innate immunity. Now, there are a few ointments which will help you a lot. The first ointment which I would like to talk about is calendula. We all know what calendula is. It's basically the marigold plant. Now, as far as the marigold plant goes, calendula is available as a mother tincture, as a cream, etc. Now, calendula can be used as a dressing. It can be used on any wound that you see. But if you take it as a mother tincture, you can also pour it over any open wound or fistulous tract. So, one medicine I have not mentioned here, it's called Hypericum mother tincture. If you combine Hypericum mother tincture with calendula mother tincture, it is called Hypercal. So Hypercal as a medication, if you combine it, you can pour it into any open wound, into any kind of fistulous tract, and it helps a lot in the healing of these tracts. Petroleum. Now, what exactly is petroleum? Petroleum is a medication which we can use in case that there is an eczema which is not weeping or it is absolutely dry. I have only put a picture of elbow callus here. I know this is not a classical eczema, but if there is an eczema which is dry, if it is dry, then what we can do is we can take this cream, petroleum, and we can apply it on any kind of a dry eczema. That's it. You can apply this. The next is what we call graphitis, a beautiful medicine. Till 2025, I was frustrated by scrotal eczema. And as a practitioner, I used to see that in Delhi, I'm not talking about the other states, in Delhi, the moment November came and the moment March came, the number of scrotal eczema cases increased. So we were thinking what could be the different causes of this. The first cause was that the moment the mopping was done with any phenyl or Lysol or whatever else, the fans were no longer put in Delhi because it used to get cold. So the floor used to remain wet with these particular phenolic agents. And when the dog used to go and lie down there, we used to get a large number of eczema cases. And this was particularly there in 2 months of the year. That was what I saw as a practitioner, one in November and the second in February and March. And we all know as practitioners that eczema can be a terrible thing because A, owners are negligent. B, dogs find a way out of e-collars to rig themselves. 3, they still manage to find a wet floor to lie down. And then we used to do everything, our normal stuff, all our creams and tacrolimus and cyclosporin, everything, even pentoxifylline, everything that I could do, we used to do, but we were not getting good cures until in 2025, I started this wonderful ointment called graphitis. And at least 20 practitioners of Delhi have started using graphitis and have got excellent cures in scrotal eczema. What we do is we of course clean the area well, and then after that apply graphitis ointment over the testes and just make the patient wear a diaper. I have tried controlled experiments in cases, some with antibiotics and some without antibiotics. And I have seen that patients, even without antibiotics, with plain graphitis and a diaper, have been cured of their scrotal eczema, which used to trouble me a lot. In fact, I have more experience doing scrotal ablations than probably any other surgery because that was the number of cases that we used to get uh, in this thing, what do you call, the scrotal eczema. Now, don't think that we can only use this in any scrotal eczema. Any wound which oozes, any wound which oozes, any eczema which oozes, clip it thoroughly. Because to me as a dermatologist, if I have a lesion, if I don't clip it, if I don't have clean boundaries all around my lesion, I just don't feel satisfied. So once I have properly clipped and separated the area, then in any kind of oozing, when I apply graphitis, I have seen a lot of results. What does anti mean? The word anti, as we know in general, is all about being against, opposed, opposite of, etc. If we look at our own practice as vets, and me included, because I'm not out of this tribe, I'm very much part of this tribe, and I was doing exactly this over the last 30 years, maybe 22 years, I was without homeopathy. We used to lose a lot of antibiotics, antihistamines, anti-inflammatories, etc., etc., etc. Everything is anti. So we should use lesser antibiotics, not only for our animals, for the environment, etc. We all know what steroids can do to our own immunity. We know the side effects. We know how certain ointments and steroidal preparations, at least we are so lucky to have IAVD, which has taught us that dermatitis is not just about steroids, because so many clinics in India are still, any case they get, they are just continuing to use steroids without any particular reason or logic, because we know steroids are required in certain conditions. We of course require steroids if you have got an acute moist eczema and you want to bring down the itching or you want to bring down something. In certain cases we require steroids, good, but not everywhere. So we have to be less anti, we have to lower the usage of our antibiotics, antihistamines, anti-inflammatories, and slowly we have to go back to what nature taught us. Similia, similibus, curanter, or like cures like, a gentler, more holistic approach. I'm not asking you for a second to stop your allopathic practice. I am asking you to think about a combined practice. To me, as a practitioner, it has never meant whether allopathy cured the patient or homeopathy cured the patient, because I neither created allopathy nor homeopathy. I just studied both. To me, a healthy patient is what is required. A happy patient and a happy pet parent is what is required, because they are the ones for whom we are taking so much stress. So this is only a lecture, a kind of an eye opener to what homeopathy can do. For that, you'll have to take the effort. You'll have to go to, I mean, we are so fortunate. Kerala, Ludhiana, and Bihar are giving online courses. Why don't you all kind of take up this course and make practice gentler with lesser medications and more happy patients? That's all I have for the moment. It's a huge ocean. It's so deep that I've just taken a plunge. The results are exciting. I hope at some point I can come back to this forum with more exciting results. 1 hour for homeopathy is just too short, but the idea was to provoke you, to make you think, and hopefully I've done justice to this. Thank you, Ivanka, and thank you, Dr. Jairam, for giving me this lovely opportunity.
Thank you so much, Dr. Unny, for that insightful and practical session. We are now going to move on to the Q&A session. What I would recommend is for the participants to put in your questions in the chat box, and I will convey them to Dr. Unny. Doc, we had some questions that came in during the session. I will start with those. Dr. Sumit has asked, which is the best homeopathic medication for mouth warts in Labradors?
Yeah, if you're talking about those white cauliflower-like warts, the picture which I showed you, uh, Argentinum nitricum, and believe me, I'll tell you a very lovely story. How much time do we have, Ivanka, to talk about?
We
10?
have some time, Doc. You can
We
go
have
ahead.
time, no? So I'll tell you a very
Yes.
interesting story. So just after COVID, I had a case of a dog a very fat Labrador who had come to our clinic, and he had been treated at 3 clinics for warts in the mouth, oral papillomas. And I decided that this owner is suffering too much and I should do something for him. So I ordered a cold laser from Chennai, and cold laser at that time cost me about 4.5 lakhs. But they said they'll deliver it to me in 1 month. So till that time, I started the patient on Argentinum nitricum. By the time the machine came, and I now have a cold laser, but that dog did not have a single wart in just 1 month. And he's never had warts thereafter. It's been about 3 to 4 years. Just one, maybe 15 to 20 days of Argentinum nitricum, and all the warts uh, vanished. Please
Wow.
also see, we have to start correlating. As a homeopath, we have to start correlating whether we are getting warts post vaccination. If that is so, we first give Thuja and then we give Argentinum nitricum.
Okay. The second question, Doc, is will Argentinum nitricum work on TVT in dogs?
I have actually never tried it because TVT is not exactly a wart.
Mhm.
Okay, let me just tell you, because I'm also a gynecologist, so a theriogenologist rather. I'll tell you something very interesting about TVT. I don't know how many of you know, but the genome sequence of a dog's have got 78 genes. Okay, but the TVT tumor itself has got only 59 genes. Okay, a tissue which is living on a dog which has 78 genes has got only
Correct.
59 genes. So don't ask me how that works out. But TVT is a totally different alien species. So I have
Mm.
never done that. And plus, I've had some excellent results with vincristine. But thought provoking, I'll definitely try it.
Great. Another question is someone has asked for the pseudo pregnancy protocol.
Why? Yeah, definitely. So we have got 2 drugs which we can use. One is called laccaninum 6x. Laccaninum is basically the milk of a dog. Okay,
Mm.
lac and caninum. And like that, we also have lac felinum, and we also have lacs of every other species, including panthers,
Mm.
jaguars, and lions. Can you imagine that?
Mm.
So
Oh,
we
wow.
have all the different lacs, and all of them work differently. But for pseudo pregnancy, what we are using at our clinic right now is a medicine called Artica urens 3x and laccaninum 6x. These are the 2 medications which we are using in combination, and we do get good results. But there also, as a therapeuticist, I'm trying to tell you that all
Mm.
depends on the ratio of prolactin and progesterone, because these two tend to vary a lot, and
Mm.
that also plays a role. plus we could have other polycystic ovarian diseases. So for that, you have different medicines. I mean, homeopathy is so beautiful. You have a certain remedy for a right ovarian cyst. You have a certain remedy for a left ovarian cyst. And there's euphorium, there is apis, etc. So depending on the cause, but they ask me a specific question, I'll give a specific answer. Lac caninum 3x along with Urticaria urens 3x.
Sir, which is the name of second medicine apart from lac caninum?
Urtica urens.
Okay.
Urtica urens. Urtica urens, incidentally, is also a medication which you can give in very severe allergies. I use it a lot in dermatology. Urtica urens, I also give in many patients who have got very severe allergies. We give Urtica urens also. I think it's called the nettle grass. I'm not sure. I don't have my book with me. Otherwise, I would have checked.
Okay. Another question is, can the graphite ointment be used in orchitis?
Orchitis, no, it will not work because this is an eczema which is working on. Anything which is oozing, that is where we are using. For orchitis, you will have different medications. There also, homeopathy works on what you call a modality. Is it the right testicle which is affected or is the left testicle which is affected? And there are different medicines for both.
Both.
Yeah. But it won't work for orchitis. It will work for a scrotal eczema.
Eczema, okay. Another question is there a homeopathic remedy or treatment for the nervous signs seen in canine distemper?
Of course. There are a lot of these things. And in fact, our clinic has now become pretty popular for having getting a grip on distemper. But we can probably control all the nervous symptoms. But after demyelination of a nervous sheath has occurred, we can't expect that the signs are going to disappear. So there is belladonna, there is distemperinum, there is Mygale acidora. In fact, all these spider venoms which are there, Mygale acidora is a spider incidentally. All these cases where we have got twitching as a symptom, chorea, all the spider venoms we can use to cure these twitchings.
Oh, wow. There is a question saying that in large animals in Andhra Pradesh, they are facing a major problem of warts on the teeth. If you can recommend, yes,
Sabina
a
200.
protocol,
It was
a
there.
treatment.
It was there on my slide.
PPT. There's a lot of requests for your PPT doc in the chat box. What is the best medicine for warts near the ear, slightly above a head in the Shih Tzu?
I would probably see there again, right ear, left ear, type of wart, round, smooth, pedunculated, cauliflower, etc. But general rule, Dulcamara 200.
Okay. Dr. Tushar has asked if you can recommend some books for reading up on homeopathy.
Yeah, I'll put it on the IAVD group the moment I finish this lecture.
Okay. And I'm going to do this last question, Doc, for today. What is the alternative medicine, like homeopathic medicine, you would use for immune-based dermatitis?
I told you, we don't believe in the concepts like we don't believe in a concept of say pemphigus. It doesn't work like that. It works on symptoms. Homeopathy is curing an individual. It is not curing a disease. There is no concept of pemphigus in homeopathy at all. So if we were probably talking about immune, I would probably give Berberis equifolium or echinacea or this or that and increase immunity. But I would focus on the kind of lesion which the patient has on his body and focus on that. For example, if we have very large bullae full of pus, okay, then I can give a remedy like anthracinum. What is anthracinum? It is made from anthrax. And what does anthrax do? It gives you red kind of bullae which has a lot of pus in it. So we'll have to focus like that and move into homeopathy. There is no one standard remedy which will be there in homeopathy.
Another last question that I found really interesting, and I'm going to use this as the last question, Doc. Is there any homeopathic medicine that can be used for treatment of epilepsy?
Oh, epilepsy, I could give you an hour and a half lecture just on epilepsy. Okay, so let me tell you. Do you know what the lunar cycle is? The waning and growing of the moon, correct? Now that basically, and do you know where the word lunacy came from? Lunacy, madness, lunar cycle. So the phases of the moon can also determine whether you're getting epileptic attacks or not. So there are certain cases where in case you have a seizure which is occurring just after or on the full moon, a day before or day after, a medicine called calcarea carb will cure the patient 100%. I'll give it to you in writing. Second, there are different remedies for different things. For example, in case you have seizures which are coming only during the sleep, buforana, it's a frog, that medicine will help you a lot. And suppose you are getting a seizure which comes out with bright lights, then the medicine is called stramonium. So it's like this. There will be about 200 remedies based on 200 conditions. But I gave you the three most common, very, very bright lights. The moment the dog sees a bright light, gets a seizure, stramonium. Closer to full moon, calcarea carb. Okay, sleep, buforana. And
again, what is causing it will then
what is
depend.
causing it?
That is what your
It's
treatment
not
will
like
depend on.
allopathy where we have Gardinal and levetiracetam and potassium bromide. No, that's not
Correct.
what homeopathy is. That's why it's
Okay.
slightly different.
Different. Okay, great. Thank you so much, Doc. That was an extremely insightful, even question and answer session, I would say. I would like to thank, of course, Dr. Gautam Unny for a brilliant session. It is an eye-opener for a lot of vets in the industry today, giving us alternative ways to manage skin conditions that don't allow for a precipitation of a lot of drugs, antibiotics, anti-inflammatories being used. Thank you for that. A big thank you to all of the participants who took time out on a Sunday for this session. And again, a huge thank you to both IAVD and the Drools team for conducting such webinars. Thank you all once again. And a last reminder before we wind up is to please fill in the form so that you receive your certificates. Thank you so much, everyone, and have a good Sunday.
Thank you.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
Drools. Drools.
Drools.
Drools.
Drools. Feed real.
Feed clean.